Hello, Madam Modesta Makani. How are you down in Maryland? This is Kidodi Podcast. It is my great pleasure to welcome you today in our episode.
Thank you so much for having me.
Okay, it was a long journey to since we met 4 years ago, and I hope today it is the time that we can discuss number of issues through your foundations, Soli Foundation, your life here in US, and Katani Hospital in Kenya. So, to beginning with, through my audience here, I would love to know your life background, your journey from Kenya all the way to United States. So, please welcome Madame Modesta for your historical background.
Thank you so much, Mr. Amin, for having me. Uh, it is my pleasure to be here and to share my journey from Kenya to America. I was born and raised in Kenya. I grew up there, went to high school in Kenya. After high school, I migrated to America. And while in America, I had the passion to go to school. I went to Montgomery College, where I got my associate degree, and I didn't stop there. I then also went to University of Maryland and obtained my BSN. I also went on and got my master's. Um, I became a nurse practitioner, for which I have worked for many years. And from there, I went on and obtained a PhD in public health with an emphasis on epidemiology. I have done different jobs from working in a hospital to working in a nursing home and to doing different things uh, because of my academic background.
Thank you very much, Madame Modesta, for your short briefing in terms of your life background, all the way from Kenya to United States, obtain PhD in public health. Yeah, let me beginning my question to you. Just tell me upon your arrival here in US. You said you came here for further studies after you graduated in school, and then what your first job here in United States. As Kenyan citizen, you are on foreign land. Tell me a little bit about journey after you graduated in school.
Uh, well, when I graduated from Montgomery College with an excuse me, with a nursing degree, I did not have any issues with getting a job. Actually, immediately got my first job in a hospital. I worked at Washington Adventist Hospital. I did that for many years. As a nurse, I was very happy to actually work. I went to work in the morning, came back home in the evening. But I was very happy with the job that I was doing in the hospital. And because of that, it propelled me to move on, to go further, and even see what lies beyond the nursing profession, the nursing that I had obtained, the degree that I had. So that's why I went back on and obtained a BSN in nursing. I also obtained Masters of Science in Nursing and became a nurse practitioner.
Okay. Yeah. Well, it's very good that you obtain that high level of education and then you practice as a nurse for some times. Let me move on to subject related to work ethics while you are working with the nursing in hospitals. First of all, as a Kenyan citizen, and your environmental is completely different compared to Kenya. How did you experience working here in the US in the beginning, associate with the other people rather than Kenyans?
Well, it was quite interesting working with different people, but I learned things very quickly. I was able to assimilate, and I was able to work very well. There were some challenges initially with the language, different words meaning different things, but I was able to adapt. And because I was able to adapt, I did not have major issues in that department.
Okay, when you are hired after you finish in school, what the date you start working here in the US after you finish school?
Well, as soon as I finished school, I actually, perhaps in 2 months, I got a job. I mean, after I finished
In 2 months.
after I took the board exam, in 2 months, I got a job.
And what leading you to take a PhD in public health?
Well, public health is not so different from just taking care of individual people, but public health, you're moving from taking care of individuals to taking care of communities. So in working in the hospital, you take care of one person at a time. But when you are doing public health, you're taking care of the community at large. So I was interested in moving away, or perhaps combining the two, with the knowledge that I have in taking care of individual patients, but combine it with working with communities to be able to reach a higher number of people compared to just one person at a time.
Okay, that's very good. Public health is more oriented into serving a big number of people into health
That's correct.
sectors. Okay, Madam Modesta. Let me ask you one of the area which is very important to me to know from you. Being as a Kenyan citizen and also come to United States here, what is your first impression when you arrival here in US? What is your first impression as a foreign
Oh,
land?
it was well. What happened is when I came here in December, so it was very cold. I'm coming from the a country where the weather is very warm. Uh, Kenya is on the equator where it was very hot, but I came here, and when I got here, it had snowed. So I was not
Yes.
dressed appropriately. I was very cold. So that that actually, it made me feel a little like I want to go back home where it's warm and nice. But but coming here also, you know, finding different people. We have different cultures, different races, all living together. Well, I'm coming from Kenya where you just have one group of people, perhaps if there's different other people, it's just one or two here and there. So meeting different people from different cultures, having to make friends with different people, going to church with different cultures, different races, that was really a change from what I'm used to. And even going to school, even in
Oh,
school was also different. Say like when I was doing my master's, I was perhaps one of the African people in the class. There was not many people from Africa, and there was not many people who are different or who look like me. But so assimilating in that culture and working with everybody to achieve my goal was very important.
okay. How you assimilate? I know it was very
Yeah.
tough to assimilate it with people that different background and different culture, but finally you managing correctly to assimilate it, and then that's the reason why you got a job into health sector.
Yes, and with that, you just have to put in a little bit more extra. I had to put in a little bit extra time, a little bit more studying than perhaps what what other people were doing. excuse me, I had to go a little bit far and beyond to be able to show that I'm capable, just like anybody else, to do what is required of me.
Okay. Thank you, Madam Modesta. Let me taking other question to
Yes,
you. I understand. We met, me and you, about 4 years
yes,
ago in Richmond, Virginia. At that time, during the time that you are prepared for some project in
yes,
Kenya. Let me ask you a question related to. I know you are founder of the Soli Kenya
yes.
Foundations. What is your motivate you after sometimes living in the US to say, okay, let me starting something here that I can help the community here in United States, particularly where you live in Maryland, uh, city of Baltimore. What is your mind decided to open uh, Soli Foundation, Kenya Soli
And thank
Foundation?
you so much for that question. Soleil Kenyan Foundation is a nonprofit organization, and the idea behind this organization was to raise awareness, but also to find resources or funds to be able to take care of people who are not insured here in the Baltimore area, especially the immigrants here in Baltimore area, but also in Kenya, uh, to help take care of people who are not able to afford healthcare here, but also in Kenya. And we have done that very well here in Baltimore. We have a lot of patients that come to the office and they have no insurance, or they're referred to us because they know about the foundation, and the families have come here and they have no insurance. They have no access to care. So they come to the office and we assess them. We provide basic care to them. When they need referrals, we refer them. This has worked very well for many of the patients that have come to the office. We have patients who come from Kenya, patients who come from Nigeria, from Uganda, from Tanzania. I have also patients who come from Bolivia. So it's not just limited to only Kenyans, but the patients that have heard about us and have wanted care or have wanted diagnosis, have wanted to be diagnosed, we've been able to do that to meet those needs for them. And this has worked very well. When it comes to Kenya, I have not actually, I can say there's a challenge about this because of the other things that I have been doing together with the foundation. It's been a challenge to put in as much time as I could have. And because of that, the resources have not, have been limited. I have not been able to raise the funds that I wanted to be able to actually build some other clinics in Kenya to support my vision. So I'm still working on it. I'm still working on it. It is work in progress.
Okay, that is part of Kenya through the Kenya Soli Foundation. It never been succeed compared to United States,
That's
correct?
correct.
Okay, what kind of successful uh, Kenya Foundation has been proud here in US to helping minority? Can you tell me successfully and challenge you have through your
Well,
foundation? And are you the president of the
I,
foundations, or
I
you
am
just are you the founder?
I am the CEO. So yes,
Yes.
I am the
Can you?
founder, and we have a
Yep.
board for the foundation. And here in America, like I said, working in the medical field and also doing some other works, which I'll talk about briefly, has taken me away from looking for funds or applying for funds and following through. So I have not been able to do that here in America. But patients who have come, we actually have taken care of them in the office here in Baltimore without fail.
And mostly, what kind of services you provided for the patient through these Soli
It's
foundations?
it's here
Any?
here in Baltimore area. We they come to the office. They are seen by me as a nurse practitioner, or they're seen by some of the doctors in the office. So we provide basic office care. And then if they need referrals to get testing, say like if they needed a CAT scan, we can order a CAT scan for them. But if they needed surgery, we can refer them to a surgeon.
Okay, how proud are you to open this Kenya Soli Foundation as a Kenyan citizen in the foreign
Yeah.
land? First, how proud are you?
Well, America has been so good because one, as even as a Kenyan citizen, but eventually I became an American citizen. Uh,
Yes, I believe
yeah,
so.
so I am an American citizen. I am a dual citizen of Kenya and America, and so America has been good because if you can do it, America allows you to do it. You can
Uh,
become whatever you want to become. And because of that, so long as you're not breaking laws or rules, the system allows you to move as far as you want. So here in America, I have not been held back. I don't think I can say that I've been held back because I'm Kenyan. I have thrived in the environment, and just I've been able to do the things that I have wanted to do.
Absolutely. That's the reason why you have Kenya Soli
Correct.
Foundation. Let me move on to subject related to Kenyan society here or African
Yeah.
society here. How do you feel about your fellow Kenyans? I know you're an American citizen at the moment, but you're born in
Yes.
Kenya. How Kenyan society assimilated to economical system in US and also uh, diaspora of the other nationalities.
Okay.
How they Can you tell me a little bit about diaspora before we're moving to another
Okay.
subject? As a diaspora yourself, and you living in the United States, it's a green pasture here, a land of
Yeah.
free, land of opportunity. You're using your opportunity to went to school, to graduate in school, working as a nurse, went to public health, take a PhD, running the Kenya Foundation, Soli Foundation. As a diaspora, how feel and how proud are you?
I am very proud. I'm very proud, and I'm proud of my fellow Kenyans. I'm proud of my fellow Africans like you, and I am proud for those who actually realize that if they abide by the rules here in America, that they can do well. And it requires hard work. You can't sleep all day and expect to produce. You have to be able to live in the society and do the things that the society expects of you. And if you do that, if you have goals, you set goals for yourself, you can succeed. So people who have come here with a goal in mind, they've set goals for themselves, they've been able to succeed if they pursue those goals well.
And how you advise to others in order to pursue those goals. You pursued those goals, you succeed now, and you are part of the African diaspora born in Kenya. What about the others? For example, if I come to you and say, hey, I need advice myself, being as a diaspora of Tanzania, and then I need to take your steps, your successful steps you have, what kind of advice you can give the others to be successful?
Well, one is that you have to have goals, set measurable goals, and follow your passion. Yeah,
The
follow
rules.
your passion, but play within the rules in the society. Um, so I think that it requires hard work. There's days when I haven't slept when I was in school. because I had to finish that paper. And I had to, there's a day where I went day and night just working on papers, and I was able to finish and submit on time. And because of that, I was able to graduate. So I think that if you, here in America, if you work hard, if you stick with what you believe that you want to do, it is doable. It is doable. So I think that as a Kenyan being here in America, I have worked hard. I had goals. I set goals, measurable goals, and achieved them. So to my fellow Africans, we can do this. We can do this. Yes.
That's good. Thank you, Madam Modesta, for that particular answer in that area. Let me move on to, I know you have another project in Kenya. Basically, that's very interesting project, which I would like to ask you some question, how you managing and how you
Yeah.
started. KATANI
Yeah.
hospitals, very fascinating
Yes.
one. I know that you complete that project and it was launched in 2019.
Yes.
And today here you are in Kidodi
Yes.
podcast. Some Kenyans aware about your project. Some people don't know about your
Yeah.
project. Can you tell our audience here how you come up to this particular project, building a hospital in Kenya, as in Kenya at that time, and now US citizens? Because diaspora wants to give
Yes.
back to our land, basically. And our expectation is too high for our fellow citizen in Africa. So tell me your journey about how you managing and successful building hospital in
Thank you
Kenya.
so much. Thank you for asking me about that. This is actually, I'd like to share about this because it's my baby. Uh,
Yes, basically, this is very important to me to know
yes.
from you because I was completely
Yeah.
inspired when we met that time. I say, hey, this is in Kenyan women here. I remember very well. Mr. Sean
Yeah.
told me we have a very special guest here coming to buy a product and building hospital. You had a couple of interview with
Yeah.
him, and I was very inspired. But I say myself, do I have to look her is one of the role
Yes.
model in Kenyan people, or do I look her is an example of African diaspora who is dedicated her life to give back to the community in Kenya? Just brief our audience here your journey for building a Katani
Thank you so
hospital.
much. Thank you. Katani Hospital is located on the outskirts of Nairobi. It's about 30 minutes away from downtown Nairobi. Like you said, it was opened in 2019, and the vision behind this hospital was to provide care to people who did not have access to care, or who had access to care, but the care that they needed was not affordable. So in Kenya, as we know, people travel many kilometers to access care. In this particular area where the hospital is, there was no other facility. There was no other hospital in the area. So when I went there, I looked around, and I was actually moved by seeing different people die at young age. Children die at young age. Adults, elderly die at ages where they didn't need to die, and they were dying of diseases that were manageable, that could be treated. Things like malaria, things like pneumonia, things like asthma are treatable, but people were dying of those. So I thought that if I put a hospital in this particular area where there was no hospital, we could treat perhaps one patient and save a life, and we could save a family's life. And so I started, I did some research and found out that that was possible to do that. I went to the government and they said, yes, we can give you the permits necessary. So I got the permits necessary to build a hospital. So we started out by just going slow. Build the first floor, the ground floor, and then we finished. And then I came back. I would work and go back and build the next floor and then come back, work, get some money and go back. Uh, but I was interested in one, giving back to the society or giving back to the community, because I know that the care there needs support. Healthcare needs support. Healthcare there was not up to speed as we see here. And so by working in different hospitals here and see how care was provided, I was interested in doing something similar in Kenya. And surely I think I have done that. I built I
Well,
built a hospital, and this
mhm.
hospital is a full-fledged hospital. It has inpatient and outpatient. It has it's a one-stop shop. If you go there, you can get all the care that you need. It's like a hospital here in America. That's and
Okay, good. How long did you take to complete this project? I know it is officially open
yes.
2019. And what kind of challenge during the constructions of this kind of project, as Modesta as a founder and initiated of the project?
Well,
Just tell me, and our audience wants to learn a little bit how the Kenyan government allowed you to acquire land and how they welcome you to your country as a diaspora, and they feel proud of you to say, yeah, you are
yeah,
Kenyans and you open this to the Kenyan people. Tell me about how long does this project complete
yeah.
and how the Kenyan government feel about you for giving back to the Kenyan people.
Well, what I can say is that the challenge I think you asked, the challenge with it was the resources to build the facility. So the first thing is that I bought the land. So I bought the land to start. So I had land available. And then I went to the government to ask for permits. So I paid the required fees to get the permits that I needed to be able to construct the hospital. So it took me at least about perhaps 2.5 years to have the entire facility in place.
2.5 years, a facility, all the entire facility
Yeah.
to take place,
Yes.
correct? Okay, so how many health services you're providing? You say it's a full-fledged
Yes.
hospitals. Is a children's
Okay. So we
uh,
have.
um, um,
Let me tell you, we have emergency room department. We have triage. We have laboratory. We have a pharmacy. We have general inpatient, outpatient. We have med surg. We have delivery, maternity. We have NICU. We also have, we are fixing ICU. We have two theaters. Theaters are state of the art. They have state of the art equipment. We have, we also, in collaboration with a physician here, we are also putting together a cancer unit. So
okay.
we can provide care to all patients that come to us.
And mostly as in Kenyan patients only, or sometimes you're accepting other people from
But
neighboring country to get
we
health
don't send
facility.
anybody away. We actually have had patients come in the hospital from England. I have one patient coming from Venice. So I think that no, we're not discriminating. We welcome everybody in the hospital.
And then how doctors? They're mostly Kenyan doctors. I know sometimes, Madame Modesta, you arranging a voluntary doctors from US going to
Yes.
Kenya. to serve in Katani
Yeah.
Hospital. Most of the doctors recruit are from Kenyan doctors, or somehow they are from outside of
Well,
Kenya.
we have some doctors from outside Kenya. We have had a general surgeon from outside, but an African surgeon from West Africa. We also have had a medical doctor from outside, from West Africa. So we have had actually three. We've had doctors from outside as well as our own doctors also. So, so long,
Okay,
so long as
the
a person is qualified, we don't discriminate.
you don't discriminate anybody as long as you are qualified based on
The
the
cor-
merit or
correct.
qualification. Yeah, you can hire anybody to your facilities in Katani
Yes,
Hospital. And then how many totally how many patients they can accommodate
we can
Katani
accommodate.
Hospital, and
Sorry, go ahead.
total patient in terms of the
Yeah, we
unit.
can accommodate up to 144 patients um, in total. And let me just say one thing. A year ago or 2 years ago, we had people come from. I organized a team of specialists come from here to come to the hospital and provide free care to the people who were able to come. So we advertised widely. We had surgeons a plastic surgeon who repaired cleft lips and cleft palates. That is for children who are born with a break in the lip or palate. We also had
Yes.
women issues taken care of. We had a gynecologist. We had an oncologist. We had different specialists come in and provide free care to the people of Katani, and we took care of almost 1,500 uh, patients in that period of time, in a period of 3 months. We took care of those many patients, and patients were very happy. They came back and said, "Thank you so much." But above that, Katani Hospital is serving the community very well. What happens is that when a child is very sick and the mother has stayed with the child at home, hasn't brought them to the hospital, it's very easy for them to run with the baby into the hospital. I've been there when different issues have come up very emergently, and they've been these people have been taken care of, and they have lived when otherwise they could have died. So I'm very proud of the work that we have done as a hospital, where we also are situated. There's mining quarries taking place not too far from that area. So people are being hit by rocks. We also have trucks hitting, in the area, trucks hitting people or something like that, accidents. Uh, People are rushed to the hospital and we take care of them. So the hospital has done a very good job because of where it's located and because it's the only hospital in that particular area. I am proud of the work that my staff does.
Okay. Let me ask you one area here. It can be controversial to you, if you don't mind to
Yeah,
answer.
that's okay.
In terms of I know you've been living in the U.S. for
Yeah,
some times, and you are aware the system of health facility in the United
yes.
States. Tell me about Katani. Do you normally accepting a system where U.S. accepting, which is insurance cover, and sometimes either you deny people for services if they come to your facilities in Katani hospitals? I know it can be economical wise, people don't have enough to cover for the
Yeah.
health issues, but do you normally providing services with the system like in United States?
Yes, and that is a good question. At Katani Hospital, we accept different insurances. So when a patient comes in and they have insurance, we do accept it. Um, but also we accept cash, but we do not turn any patients away. For any patient that comes in, we treat them, and we don't ask for money up front. We treat them, then we ask for them to pay after, they're feeling well. Usually these patients they don't have a lot of money, not even a lot of money, but when they come in, they probably don't have cash on them, and they have to sell something to actually pay for their care. So when they come in, we treat them, and then we make arrangements. And sometimes it's a challenge because they may not have anything to sell, or some of them are moved away from the village to come to look for work, and they don't have work yet. But you have to save a life, and then we work it out later. Yeah.
Okay. Final question to you, Madam, before we're closing here. As I am aware that you have a Kenya Soli Foundation, never successful in
Yeah.
Kenya, comparable to
Yeah.
US, but also you have Katani
Yeah.
hospitals. How these two working together to serving people in Kenya,
Yeah.
particularly in Kenya, how you coordinate all together in Kenya, not in
Yeah.
US. Katani is located
Yeah.
in Kenya, but Soli Foundation also serving people here in United States.
Yeah.
Let me go back and
Mhm.
ask you about Soli Foundation in Kenya associate with Katani
Okay.
Hospital
Yeah.
in terms of insurance, referable, and
So
other stuff.
the two entities are different. They're different. But we provided care in Katani Hospital for patients who may not afford to pay. But Soleil has not been able to support um, Katani Hospital at this time. It has not been able to support it at this time. Now, I'm hoping that in future it does. It'll be a good thing to actually have the foundation support perhaps one of the initiatives in the hospital, but we haven't gotten there yet. And
Thank you very
it
much,
doesn't
Madame
mean
Modesta.
that we will not get there. It just means that I haven't worked on that particular aspect meticulously to be able to get it working.
I hope one day Soli Foundation will be able to serve Kenyan
Yes.
people.
Yes.
I believe so. I believe so. You can be able to reorganizing and make sure that, because Africa, there are so many people needs help in terms of any area of the healthcare. Let me finally conclude to
Let
you,
me just say,
Madam. That's the last
one thing. And I can actually reach out and call out for help. I am not afraid to do that through this podcast. If anybody is interested in helping Katani Hospital or helping Katani Hospital through the foundation, I welcome that. It will go a long way. And I'm calling upon all the Africans. We are all connected, or non-African, or anybody who can chip in something. $1 at a time can go a long way. Thank you.
Absolutely. That's the reason why I call you to come to my
Yes.
podcast, invite you here to promote not only Katani Hospital or Soli Foundation, but to give the opportunity for the African diaspora to know Modesta, who is Modesta, what she has done in Kenya and here in US. Final thought to you
Yes.
today. What kind of your advice? You completely Katani Hospital in Kenya is a role
Yes.
model. What is your advice for other diaspora of Kenyans or other diaspora of Africa to take the similar engagement that you did in Kenya? People listen to you here today. What is your final thought?
Thank you so much for that. But I can say that as diasporans, we have left a vacuum back where we've come from. We have nobody is there to fill that vacuum. So we need to look back, and to fill that vacuum, we can do something there. It doesn't have to be a hospital. It can be a clinic. It can be anything that you think can help people there. I think here in America, what we do is we look at ourselves as individuals. I want to just do it for my family. I want to do it for my brother, my sister. But we have to look at a larger community, because what has Katani done? Katani has provided employment to a lot of people in the community. The young men and women in the community have employment through Katani Hospital. And because of that, they are able to educate their children. So I think that as diasporans, we have to look at it as helping a community can also help your family, can help many people. But also, we have to know that we can do something. We can do it. So long as you start something, put your mind to it, you can do it. It doesn't take a lot. I didn't start out with millions of dollars. I started out with some money, but then you have to keep building it up. So you don't have to wait until you've saved so much to do it, because it will not happen that way. Start with whatever you have. And then once you start, you have to either find people you trust to work with you, or be able to go there and be able to engage yourself in what you want to do. I have been to Kenya so many times. Sometimes I go 3 times, sometimes 4 times, but also I'm on the phone even while here. And that's how I've made it work. You can't start something and distance yourself and then think that it's going to work. You have to be engaged, because your vision is not somebody else's vision. It is your vision. So you have to build it up, and you have to mold it to where you want it to be.
Thank you very much for your final thought. It was also my pleasure
Yes.
to join with me here, Madame Modesta, from Maryland today. And your final thought, people here. I hope some Kenyans who are listen to you, me, and here, they will be taking care of this thought and starting the new journey and new chapter for their life to give back to the community of Kenyans and Africa. And also, my fellow diaspora who listen to our podcast today, Modesta show example in Kenya. We need to dedicate our life to take care our people in Africa. Thank you very much, Madam Modesta, for joining with me today. It was so pleasure and very profound happy. And I look forward to welcome you again in my episode sometime in the future. Thank you. Be safe out there in Maryland. And thank you and bye-bye
Thank
for
you so
today.
much. Thank you.